Welcome to today's webinar. Our topic for today is Reopening Senior Living in 2020. My name is Megan Klein and I will facilitate our meeting. Please note the information contained in this presentation is intended to provide general information but not advice about certain regulations and initiatives. This is not intended as legal or other advice, and each situation may vary depending on the particular facts and circumstances. You should not act upon this information without first consulting with qualified legal counsel. Today's webinar will be presented by Liz Jensen and Gaurie Rodman from Direct Supply. And now, please welcome Liz and Gaurie.
Hi, Megan. Thank you so much. And hello, everyone. Gaurie and I are so pleased to be here today with you. My name is Liz Jensen, and I'm the Clinical Director at Direct Supply. And today we're going to spend a little bit of time just talking about some reopening strategies for senior living. This has been a very challenging time for senior living providers across the country. And many are in a place right now as of June 23rd, where we're starting to think about what comes next. And in certain states where we might have the opportunity to start thinking about reopening or welcoming visitors back in, some considerations for how to think about that and some ideas for that. So I'm going to turn it over to Gaurie at this point. She'll introduce herself and then we'll move into some content.
Thanks, Liz and Megan. My name is Gaurie Rodman, and I am our Director for Development Services. I'm an architect and planner and have been working closely with the team as we begin to look at following all the events in the early part of this year and all the operational challenges that our operators had dealt with. How do we now move to the next step? And we know there's a lot of information out there. And Liz and I, as we were chatting about it, were thinking about how do we kind of humanize all these checklists and processes and look at what we need to do from the lens of the end users and the staff members and the visitors that come. So our agenda is, it's going to be very conversational, but we're going to talk about kind of all of those checklists and documents that are out there and the guidance that you have. But we really want to look at that from the lens of, how do you instill confidence in all of our constituents about how coming back and living and engaging in our communities. We're going to talk about experiential planning. So this is going to be a little bit of a different lens. And then we're going to talk about implementation strategies. So we just are excited to bring this information to you. Liz?
All right, good. Thanks so much, Gaurie. So I love how Gaurie talked a little bit about some of the implementation guidance and the plan for today, how we're going to talk about instilling confidence. And before we get into some of the meat of that, I think it's really critical that we spend some time talking about who's on your team and thinking about who's on your team. Many providers that Gaurie and I both engage with every week have been thinking about this for some time, and many have actually formed reopening teams themselves or COVID-19 response teams within their own organizations, and finding really the value in the interprofessional, interdisciplinary work and the different lenses and views that different people are bringing to the conversation. This is such a complex undertaking to be thinking about how we're managing both the clinical aspects of this, operational aspects of it, and making sure that we're helping our create environments that are safe and instill confidence in our residents and their families. And so thinking about who those people are in your team, the obvious ones such as clinical leaders, operational and the environmental leaders, but also we would encourage you to think about including residents, families, and perhaps others from the community that have a vested interest in seeing your community be successful in reopening as well. Many have new ideas and innovative ideas and different ways of thinking about helping you be successful. So don't be afraid to reach out. We're hearing from providers that are already doing this and are finding that this is really helping them develop relationships and confidence in the community at large when they're coming at this together as a group, as opposed to just taking on that responsibility for themselves.
I think that's a great point, Liz. I think one of the things that we've realized when we do planning work is that the more voices you listen to, not that you have to follow all of that, because at the end of the day, this all has to be balanced with the operational requirements as well as the financial requirements. But the more people are bought into your processes and in developing your strategy, the more they're going to abide by it, and they feel like they're a part of it, and they're not being forced into something. So I think that's just an excellent strategy, beginning with engaging everybody.
Mm-hmm. Yeah, and I think, Gaurie, you and I have talked before too, and sometimes I think from a clinical and operational perspective, we often feel that responsibility that we have to own this plan, and that we are the ones that have to come up with it. And many times that allows us to be a little more vulnerable and allows us the opportunity to help others see that we're human in the middle of all this as well, and we're trying our best and we're doing what we think is right, but being able to have some more of that feedback is really helpful. That takes us kind of into this next phase, and you touched on this before, Gaurie, as well, around implementing reopening guidance. And we put this list together. I expect that we'll continue to see more lists come to bear, but many of us in the senior living space are paying attention to some of these reopening guidelines in particular. So we know the White House put out their guidance on opening up America again, which sets kind of this broader look at considerations for communities and organizations to be thinking about as they're reopening. Certainly within the healthcare environment, which both skilled nursing, assisted living, and even independent living to a certain extent are having to think about that CDC guidance and how do we really help people stay safe through the lens of good evidence-based practice and good science, which is really where many of our policies and procedures will be rooted in, is that CDC guidance. CMS has issued nursing home reopening recommendations. And even though those are for nursing homes, I do think that there's value for assisted living providers in reviewing those. There may be some ideas and some tidbits and some things that you might be able to glean from that, even if it's just a process-related idea that might be able to inform some of your opening guidance as well. The National Governors Association has put out some opening guidance as well. Many states are taking a lot of this more federal guidance and then applying their own state lens through this too. So depending on the community spread in your particular state and within your communities, you may have some additional restrictions or requirements to follow. Certainly, we've seen some nice tools come out from some of the trade and professional associations. These are just a few. Argentum, ACA, and NCAL have put out ideas. Leading Age has also put out some guidance as well. So I would encourage you, if you're a member or belong to some of those organizations, that you take full advantage of some of the tools and resources that they're providing for you as well.
One of the things that we've learned over this time, and especially at Direct Supply, we've been kind of facilitating conversations among different operators across the entire country and different levels of care, from the skilled nursing arena all the way down to even active adult and independent living. And there's so many things that we can learn from each other, because usually we kind of stay in our little bucket in our world of, I'm assisted living, this is what's pertinent to me. I can't learn anything from skilled nursing, or that's not relevant to me. But in this situation where it is a healthcare management thing, there is a lot to be learned from each other. And so sometimes, even if it's not directly applicable to you, looking at some of these other checklists and guidance might give you an aha moment. And there is definitely value in that.
I agree, Gaurie. We've been hosting some calls with Direct Supply customers, and we have a group in particular that I work with, which is made up of nurse executives from skilled nursing organizations and nurse executives from senior living clinical organizations. And those two nursing leadership groups, although they operate organizations in a different way because of the different regulations around them, we're still at the heart of all of this, caring for older adults. We're caring for seniors with multiple comorbidities. We're caring for people who have been isolated from families and their friends within their communities themselves. And so many of the things that are happening to the residents we're caring for are very similar in these situations. And the staff is having to react in similar ways as well, with using PPE and learning how to use PPE in different ways. And so I think that there's a lot to be learned, and they're finding value in working with each other as well. I think it's one of the really interesting and cool things about senior living and senior care in general is the willingness to collaborate. So we talked earlier a little bit about instilling confidence. This is something that I've been thinking a lot about. And, as a nursing leader, in caring for people, we want people to feel confident that the care that we're providing for them and the processes and policies and practices that we're engaging in, that they're being delivered in a way that is professional and follows both evidence-based guidance as well as the regulatory and risk management related guidance in order to keep residents and staff members safe. And so this idea of how do we help instill confidence is rooted in some of the things that we've talked about already. And as we get into this next part of our conversation, we're going to be talking about opening milestones. What are the things that will put the rails back around maybe a closed environment versus a more reopening mindset? What are some of the operational protocols we should be thinking about and making sure that we have in place? Resources available for both staff, residents, and visitors, certainly communication plans. I think what we're learning, I think many providers have learned through all of this, is communication and ongoing and frequent communication and honest communication, transparent communication has been really critical in helping people have confidence in the fact that their loved one is being cared for, especially when they can't visit and they can't come into the communities themselves to see for themselves. And so having new and different ways of communicating has been really important. And then finally, we'll talk a little bit about just being flexible in response and your monitoring plan. Things are not set in stone. And we actually went back and forth a little bit to say, should we call this session reopening post-COVID, and we decided not, because we're really not post-COVID. We're in a COVID world now, and COVID will be a part of our world for a long time and maybe ongoing forever. And so we'll have to find new and different ways to be able to continue to flex our response and our ongoing monitoring plan to know when we should be coming back into a more lockdown environment versus flexing to be more open. And so we'll talk a little bit more about that as well as we move into the next few slides.
I think the idea, Liz, one of the ideas, Liz, about in terms of instilling confidence, because as you said, we're still in the midst of COVID and we don't know what direction it's going to take over the next 6 months, and it may go away, it may not. But the idea that you have a plan in place to adapt to it, I think is going to be really important, not only for the residents, but their family members, but also for the staff members to know that, this is not, the gates are wide open. Like they may close down and it's kind of a loose opening, and, kind of incrementally move into this, recognizing that we may have to go backwards to move forward. And one of the things I have been talking with an operator out of Colorado that was talking about things. And I said, it might be worth your time with every resident to sit down and almost have a Zoom family conference. What happens if mom or dad end up with a fever? What's our protocol for that? Who do you call? Are you going to be informed? So as an adult daughter, if I know something is happening to my mom or dad, I know that the system is in place, that they're going to inform me directly. And for the staff member, that also helps because they know what to do when that arises. It's not like, oh my God, what do we do now? Which is kind of where we all found ourselves when this all hit at the beginning. Now, if we have things in place, we take a layer of anxiety out. And I think that's where we instill confidence.
Mm-hmm. Absolutely. And I think, thanks for sharing that, Gaurie. You and I talked about that when we were preparing these slides, and those kinds of ideas and being able to share and learn from each other as far as what's working in other communities is so critical right now. None of us none of us have this all figured out. And we're all learning together as we go. And I think that's been one of the values too in having this multidisciplinary approach to this, is that we're coming up with new ideas and different ways of sharing how to communicate things that are working or not working. And so that is a great example of instilling confidence. And I have an example that I'll share, and personal and professional examples where communication hasn't worked well, and where staff members, because we've had a hard time staffing a community, are coming in from other places. They're being shared amongst different communities in order to be able to fill staffing gaps, or we might have to bring in agency staff. And sometimes we forget that the new staff members may not be aware of and or have all of the information that they need to effectively communicate as well. And we've had some of those experiences that I've heard about where staff haven't been fully informed, and in some instances the family's more informed than some of the staff. And so we really have to be cognizant of that we're every day and multiple times a day, there's a need for those touch points and that ongoing communication to stay connected.
Yep.
One of the things, one of the frameworks that, it always helps me to have some different analogies to make. And I think about, as I look through all this opening guidance, what are some of the things that, what I call like the gates and hinges? What are the things that are going to close your community back again, or be able to allow your community open back up again? And what are some of those milestone or hinges that have to happen in order for that to occur? The first thing is really, what are the conditions in the community? So that's your community at large. What is the current spread of COVID in the community? And then do you have spread in your community right now? CMS in their current guidance right now has been clear that that if you've got an active case or a positive case in your community, that everyone has to get tested. And so we that moves us from just that baseline testing, which we've been all working on to try to get finished and have that established baseline done, to this kind of ongoing monitoring of what's the hinge then that says, well, when will I have to do widespread testing again? When will I have to, how often am I going to have to test my staff again, and so forth. And so being able to stay on top of what's changing in those areas. And again, that's where I think if you're an assisted living provider and the state has limited guidance for you, or if they've not provided good guidance, you may want to look at some of the CMS guidance and look at some of the gates and hinges that they're putting up as you're establishing your own guidance and practice as well. Just the absence of guidance can be both confidence inspiring to say, well, hey, we can kind of craft what we want, but it can also be anxiety, an anxiety driver as well, because not knowing for sure where your gates and your hinges are can also be difficult for providers. So, these are some key areas where you're really going to want to focus on having some clarity around what's our plan for daily screening. How are we screening our residents? How are we screening our staff members? How will we plan to screen visitors once we start allowing them to come back in? How will we document and monitor that ongoing? What are the resources that we'll need to make sure that we can open and feel confident that we're opening? Obviously, PPE is a big issue, and having enough PPE that we can also provide for staff and provide for visitors to be able to come into the community is a gate and a hinge. If we don't have that, if we don't have those supplies, we can't safely bring people into the community. And then obviously the capacity to adapt. I think the ability to make sure that you've got enough staff, that you've got enough confidence that you have the resources and the processes in place in order to be able to open up and feel confident that you can stay open, knowing that that might change. You may have staff members that become ill and can't come to work, and you thought you were doing all right with your staffing plan, and now all of a sudden you're not. And so you may need to have that ability and to set up that ability and capacity to adapt ongoing.
I think that another part of having this plan with the gates and hinges and the understanding of the operational protocols you have to have, the communication plan you have to have, is that there's a financial component to all of this, right? Because we're all in a scenario where our admits are down because we just don't have the sales and marketing machine working. And on the other side, our cost to serve is a little bit higher because of the staffing challenges and potentially bringing agency staff in place. And all of these are going to cost money. So having a plan in place that kind of allows you to address that component of it, because it's not singularly saying, I'm going to follow all the guidelines to a T, it's got to be financially viable. So I think having the plan in place so you can actually begin to put some numbers again is really important as a part of this opening up that we want to need to do, so that we're not only prepared, but we're financially viable moving forward.
Yeah. Gaurie, you mentioned something the other day that I thought was interesting, that you had heard from some providers that were using almost like a color-coded response plan, right? Like a red, yellow, green. And was that also something that was allowing them to put some dollars against that, to say, this is about when we're open, this is what our resource utilization will be, and that allowed them to even put some framework in thinking around that?
Oh, absolutely. And we were talking about it really from the lens of, a lot of what you and I are talking about, Liz, is kind of this immediate opening the doors. But I think the plan has to also be a little bit beyond that. What actually has to systemically happen to the facility. Things are going to change, even from, and we'll talk about this in a little bit, but how do you put a plan in place for that? And how do you adapt your building to a different critical condition on the outside? So the way that we looked at it was, green is business as usual, how our community is designed, how we operate, who we serve, all of that stays in place. Yellow is when there might be a challenge coming. It could be, to stay out of COVID, say it's even flu season. In that scenario, what is our strategy? Is there a way that we divide up and spread our building? Is there an operational shift that happens? And in a red case is, okay, we have a crisis in hand, whether it is that we have residents in-house, we have to start putting people and isolating them. What is our strategy for each of those? And what are the financial needs of those? Because some of this is around the capacity to pivot quickly to a changing scenario, right? And what you don't want to have happen is that it just takes you unawares, because, that was a little bit of the situation with the PPE. It was not only the PPE, it was accessing it, but also funding it, right? Like all of those have to be thought in comprehensive fashion.
Mm-hmm, mm-hmm. So Gaurie, I'm going to turn it over to you for a little bit. And this has been, as a nurse, again, I love learning about how you as an architect and from a design perspective think about the built environment. And I think that the way that we can start to, blend both that design element, the building, and the clinical needs of our residents, and how we create a safe environment and how that instills confidence is really interesting. So I'm going to turn it over to you to talk a little bit about this next slide.
Thanks, Liz. Yeah, so for us, as we're looking at it, first of all, we've taken a massive backseat at this point, because the last thing any one of us wants to think about is remodeling our building or planning for new buildings, because we have to deal with what we have in front of us. But what we have been doing is having lots of conversation with our partners out and doing all this heroic work on the front lines, and say, how could our facility have better supported you in this kind of a situation? What could we have done differently? How can we be better prepared? And looking at it from a couple different lenses, by care type, but also looking at it from existing buildings versus planning for the future, because the bulk of us are in midst of operations, right? So what can we do within those? So we looked at it in a couple different ways. We really believe in this experiential planning, where we're really, especially in our industry, yes, we're creating a home that somebody aspires to come live in, but it is where somebody lives and is active, and their healthcare needs are looked after. So the building really has to be accommodating for that. So we looked at it from the lens of, what is the resident's experience in this building? What is the staff experience? Because you have good, happy staff that know what they're doing, and that it has an impact, your residents will be happy. And then the guest experience. And when we talk about guests, we're talking about family members that are coming in, but also other outside partners partners who may be providing services to our residents, and maybe their partnerships and operationally you have, every one of those folks comes in and out of the building. So that's really what we looked at from that lens. We also looked at it a little bit from, how do we very quietly say, how do I keep any kind of pathogen out of my building? So what are my entry points? We looked at it from that sequence. Then we said, if everyone is safe now inside the building, how do we then move through the building? How can I get somebody out of a resident unit into common areas? What does that look like? Then the third one was, how do we have that interstitial space, right? Like, how do I connect with outside people now on a incremental basis? So we'll talk through all of those in the next couple of slides.
Mm-hmm. Yeah, and I think when I hear you talk about this, I think about the CDC's hierarchy of controls, and and when we think about ways to eliminate or the engineering controls or administrative controls, a lot of this kind of thinking falls into that. And so the higher up we are on that hierarchy, and the more systemic we can be in our thinking about the building as an integral part of that, I think helps our staff minimize the impact on the individual decisions that we have to make every day then too, knowing that the building's kind of doing its part, right, to help with keeping people safe.
Exactly.
And I love that kind of thinking.
Yep. So, this is how we looked at it was, we have the protocols coming from our checklist around how to, first and foremost, open up the building to residents. Like, if you think about this, what we did was to keep everyone safe. We actually contained people and pulled them into their resident units. That was a divide and conquer situation, right? You're safe there because you can control that environment. We're beginning to look at it from a lot more systemic situation in terms of, what does the air quality in that space look like if you're going to be in there? But now we have to think about opening up to residents so that residents themselves can move within the building and go back to that fulfilled life that congregate senior living offers. So how do we first get more people in? What are our protocols about getting people in? What is that screening and education? I think the more we're very adaptable as human beings. I mean, look at all the TSA stuff we deal with, and we roll our eyes and we deal with it. I think we're now in a whole new norm. And so that screening and education piece is going to be really important. And I think that when we talk about the residents, even for the residents themselves, it's the idea that some of this is being done to protect you, but also protect all the people that you want to interact with, right? So how do we start opening up the opportunity for people to interact with each other? One of the things we've also done is try to look at our communities and start creating mini ecosystems so that you're not opening up to 100 people, you're opening up to your community of 8 or 10 or 16 or whatever the number is and whatever the configuration of your building allows you to do. But think about that, how that then translates to activities, right? The way that you do your dining program, the way you do your therapy, the way you do any kind of social activity and engagement, you've just opened up the world a little bit more. And that's an incremental step before you open up to the entire community. So I think that establishing protocols with that lens is going to be really important. Even the idea of daily screening, like prior to doing everything in that unit of 16 or that area, this is what we're doing. We're all checking, we're all good. Now we can move on with our life, right? It's again, going back to that instilling confidence. And if something isn't good, then it's also a way to kind of contain within that area. So it provides two different things. When we talk about opening up to visitors, it's the same thing. And on the visitor thing, it's a little bit different. The screening and education is really important. The expectation that PPE is going to be a part of your visit is really important. But the other part of it that we've talked about is how they move through the building is going to be really important. Because now it's suddenly that, remember I talked about coming in from the outside world, we don't have any control of where they've been or what they've done. So how do we ensure safety coming in? One of the things we've started talking about is, and again, going to the red, yellow, green situation is, if it's a yellow or red situation and you have uncertainty around where you are, would it make more sense to say, I'm going to adapt a room in the front and that's going to be my short-term visiting room? Do you have protocols with outside partners that are coming in and say, you know what, if you're going to come in to our community to provide services for somebody, whether it's outpatient therapy or something, here's all the conditions that I want you to do. And that's part of that screening and education piece of it. So managing the visitors is, I think, really important.
Yeah, agreed, Gaurie. As you were sharing some of this, I'm thinking too about some of the other resources that I've been hearing providers tap into and utilize. And I know the CDC hosts these clinical outreach calls, they're COCA calls that they're called. And they recently held a educational program for skilled nursing providers on some of these ideas, especially around the move-in and admission process with residents, and giving some examples as well of setting up COVID care units versus non-COVID care areas, and then also having spaces for observational care for perhaps someone that's just moving into the community that is awaiting test results, or if they've had test results that show that they're positive or asymptomatic and negative, that they're still going to be monitoring them when they first come in. And so having some of those gates and hinges, again, right, of ways to control for or manage your population within a system and a process that extends what you've been learning from your lockdown time into this new way of thinking and how it can continue to expand. So that's great.
And it's two lenses, right? It's the idea, and this is, the idea of engagement. The isolation was important because it protected you from the healthcare crisis. But realistically, if you look at a human being, and we are all experiencing this, right? We're in our apartments, we're raising kids, we're doing work, we're doing everything. And then you take somebody that is a frail senior that loses, they move into our environments because they like the human connection. So balancing that is going to be really important. That's why the protocols and the systems are going to be really important to do. And the indoor visiting spaces, I touched upon this a little bit before. One of the things we've talked about is our lobbies and entryways are going to be a little bit different. And they're going to feel different. We've started looking at, in Japan, what do they do? Culturally, they're used to taking their shoes off before they walk into a building. Not kind of our psyche, but maybe that's something that we're going to begin adapting to. And how do we make all of this not be so much swinging to the other side that these home environments which we're creating become much too clinical, right? So it's that interconnection between the two, so that as we open up more, it still feels safe, but it also feels welcoming. So the location and access has to be very deliberate. It can't feel like I'm just going to convert this and make this be what it is because I'm in this health crisis mode. The art of it's going to be to make it feel like it's still serving those needs, but in a way that still goes to your core values of how people live in your environment. PPE has got to be a part of your standard, right? Like, what does it feel like? Is it something that everybody does, so that this entire biases against I do, I don't goes away? And I think on the cleaning thing, that is instilling confidence and knowing that, hey, when you leave, this is what my protocol is going to be. If a family member, if you're using a visiting room and you have a family member and the resident spending time together, we've even talked about, do you take a small efficiency apartment or room right at the front of the building, closer to the front entry, so visitors aren't trooping through your building, and make that a visiting room. Now you have access to a full bath. You're right. It's a little bit more comfortable than just say, I have a living room. You have a little kitchenette. You can actually spend some quality time together. But then on the reverse side of it, you also have critical protocols around how that space gets cleaned when somebody comes and leaves and things like that. So really looking at those indoor visiting spaces very creatively. We've also, I mentioned before, kind of creating those multiple ecosystems. Do you have a visiting space within each of those ecosystems, right? Is that one method to look at it? And the outdoor visiting spaces, I think we have to start being really creative, right? There's opportunity here, especially as we're in this summer nice season around really good programming that also allows us to continue having distance, giving variety. It's even more important today to put our creative hat around socialization within a healthcare crisis. We just have to look at it from a different lens. Like all the fundamentals of why senior housing brings value to the quality of life still remain. They do not go away. We just have to put this layer of safety systems in place for it. So outdoor visiting spaces, I think they were already going into that direction, need to be even bigger. Some of the things we are seeing, though, is as I'm saying they need to be bigger so we have distance, I'm also saying they need to be smaller because you want to look at them in smaller groups. So if you think about that ecosystem I was talking about, almost saying for this 16 rooms, I have this outdoor space, right? An adjacent outdoor space. So start carving up so that you're, again, same thing we're doing in the community where it's not one big massive dining room. We're doing the same thing with the outside spaces. And again, access, location, programming, those are the key things first and foremost, and then the healthcare piece of it, right? The PPE and the cleaning. We have to look at each of those spaces with that, with the eye to the fact that we want to continue enhancing what the socialization piece of it's going to be.
Mm-hmm. I love the picture that you picked for this slide, and we know that there's not good social distancing happening, there some of it, but the idea of finding new ways and different ways to engage, and some creative ways to engage outside. I think even some of the and all of this is on a continuum, right? I mean, I think that obviously the image here imparts that we're much more open perhaps than we are currently today, that we're aspiring to get back to this place where we can be that. But knowing that everything has to start someplace. And so we know, like current states today, there's a few states now that are opening to allowing outdoor visits for nursing homes. And again, some of those states might not have good direction for assisted living. Some of them might, or provide more restrictive guidance to that. So understanding kind of what's possible, what we're capable of. The creativity is amazing. We're seeing, I've heard some of the nursing leaders that I work with they've got people in their communities that are creating like plexiglass visitation areas where they're looking at different ways of establishing ways to be able to talk through and listen through the plexiglass that helps to minimize some of that. Even just the creativity with positioning chairs and putting some distance with tables between chairs, I think, is helping as well. And those visualization, those cues to be able to remind people to stay apart without maybe putting big pieces of yellow tape everywhere. Right.
We had one operator who started looking at the corridors and saying, we're kind of looking at the corridors like as if though it's a little front porch, right? So like every unit has a front porch, and we're going to all sit out on our front porches and have a margarita night, right, for Cinco de Mayo or something like. So the programming changes. We may not be going into a room, but we're all coming to our front porch and we're sitting there. And I kind of laugh because my brother has young kids and he lives in an older community that has front porches, and that's exactly what they're doing in the community. So kind of replicating it within ours. And we're starting to think, there's lots of ideas that come from that, right? Right. The idea of being able to sit and chit chat and do that without actually getting right up tight close to each other.
Yeah.
So this is probably one of the most challenging things, and I love this picture that came out of Senior Housing News that an operator is doing around social distancing and physical design. It is a challenge, but I always think that when we put a ton of constraints on people, those that are so committed to make it work, just think outside the box and come up with ideas. And I think our caregivers have done a remarkable job. I mean, whether they are really specialized care like nurses to somebody that is a medical assistant or a CNA, whoever it is, they're just putting their thinking hats on and saying, okay, how do I engage with people? How do I do things? So really looking at, I need to want to open up dining services beyond simply delivering a meal to a resident unit where they're having the meal by themselves, and thinking outside the box of what that begins to look like, pop-up kitchen, something interesting, something that intertwines dining with socialization. We have a client of ours who does these, kind of like beer flights or wine flights, but they do it based on you're going to France and there is a movie that's shown, it's down a hallway, they just get a big monitor, roll it up, and it's movie night. It could be French, but they have music and food all together, but all done from the confines of where your space is. So really starting to think about, we cannot let those pieces go, and how do you still do all of those without actually having to congregate into a space? The key to that is understanding how the residents flow in and out and engage in that, and how the staff move about into those spaces, right? And again, in each of these spaces, there's a lot of attention that needs to be paid into how do we manage cleaning, disinfection, and HVAC. One of the things that later on we'll talk about is some of the stuff that can go in and actually clean pathogens out of air filters. Our buildings are going to have to be cleaner. They're going to have to be healthier. Some of these reopening and dining services, we're seeing the value of biophilic design, getting more natural light into these places. So when we talk about the physical design and the segregation planning, it's the number of people that come, it's a timing of all of those. It is definitely both a building as well as an operational interconnection to make this happen.
Mm-hmm. Yeah, and Gaurie, thank you, and I love this image as well. And again, it reminds me of the hierarchy of controls. I mean, this is really the engineering and controls in particular that we can put into a community that naturally help with keeping people safer, because we've got good protocols in place, we've got good design elements in place, and we've thought through how to minimize the potential transmission of organisms. Our attention to this won't just impact COVID. It will also have impact on other viruses and other conditions that we've struggled with in long-term care for many years, things like norovirus and things like the flu, and even things like C. diff, where we've struggled with containing some of those and managing some of those, and have had problems with outbreaks in some instances. And so there's, I think, some unintended benefits that will come to infection prevention and control in general because of this new kind of thinking that we have to put into place around COVID.
Well, I think that PPE is the last line of defense, right? It should not be your first line of defense.
Right.
The protocols, the physical segregation planning, the flow of our residents, how we manage all of that is the first line of defense. Once you have that, then yes, in a pandemic situation, in a health crisis situation, whether it be flu season or whatever it may be, then the PPE is very much required. But there are so many ways that we can do this in a way that still keeps the quality of life well for our residents and for our staff members, right? Because we have a plan in place. We know how we're going to kind of divide and conquer and get past all of these things. So I do think that now that we went into the one direction, we have to come back, learn the lessons from our operations in the last 4 to 5 months, and now look at it from this lens.
Mm-hmm.
So
go ahead.
Well, I was just going to jump in just to introduce a little bit of this. Some of the things that we have to recognize is that there are going to be new things in play because we are in this COVID-19 world. And one of the things we've seen coming up is this telehealth notion, and especially in communities, being prepared for this systemically, not just on the technology piece of it, but that you have the area identified, it has the proper lighting, it has the proper Wi-Fi, all of those things. That is potentially an investment. Some of these new services and partnerships are investments that are going to help everything else we talked up above. And so this is where careful planning is necessary, because this is a financial investment. But it's going to have dividend payoff in the fact that the revenue side of it.
Right, absolutely. I'm sorry to interrupt you, Gaurie. part of our conversation. And I love that you've got another food truck too, by the way. So that's fun.
I'm a foodie. What do you say?
There's a food truck theme here. I love it. I do think we have seen, both by requirement and by desire, many of the things that I can speak to from an innovation perspective and the work that we do out of our Innovation and Technology Center, where we're working with a lot of startup companies where we've been looking at innovation in senior care for years. And there's a lot of really great ideas, and it's been very interesting coming into this pandemic and recognizing that some of those innovations are things that we've really needed. And so it's fast-tracked some of those elements into our space now, things like telehealth, things like, remote monitoring, things like, innovations in air quality. We are now prioritizing, I think, in ways that we hadn't been able to before, not because the desire wasn't there, but because we were pulled in kind of different directions and always needing to create that balance between what we're investing in and what we can our business can support. And so we have seen benefits of telehealth. We've got a lot of work to do yet, I think, in making telehealth an ongoing access point for older adults who live in our communities and for the communities themselves to have good systems in place that they feel confident will support and deliver on their needs going forward in a responsible way that gives them HIPAA protections, gives them the ability to bill for services that are provided through that, and that financially they can afford some of the technology that comes along with that, not to mention the education and the general connectedness into electronic health records and so forth. So we've been kind of launched into the world of telehealth, but we know that we still have quite a ways to go in really making it an ongoing and really consistent part of our healthcare delivery process in senior care. I think remote wellness and social engagement, we found a lot of benefits with that, and there will be continued ways that we can continue to innovate there as well.
I think that the idea of going to the point where our buildings become part of the caregiving and that we actually have smart spaces that can actually begin to address some of the things that staff are doing now. I mean, it's kind of the perfect storm, right? Like, we know we have staffing challenges and we know we need to send the staff where they're really needed in that critical care component of it. Yet, is there something that we can do that we can help continue to monitor a resident within their space because of smart technology? So I think there is so much room for innovation and to recognize that we can't be everything to everybody. Partnerships are going to be really critical. And when we can't physically move a person or from a space to another space, how do we continue doing that engagement? So I think that there's going to be layers of innovation happening. The first is, how do we open up post the event that we had and the shutdown, right? Because the lessons learned, incorporate them. And the entire process of innovation is incremental. It's not a big leap, right, from one to the other, because it has to fit within how we serve our community, who we serve, and all of those elements that are so important to why you're successful.
Yeah, agreed. I think, when I think about the staffing perspective as well, and where we've seen the trend of, we've been seeing the trend before COVID, I think, of more and more people choosing to stay home for longer periods of time. And some of this technology is allowing people to live at home longer. And making the decision to move into a senior care, senior housing, is one that is sometimes driven by crisis, maybe more times than not, unfortunately, and or driven by choice. And finding that right balance between how as a senior care provider, how we're partnering with home health providers, how we're partnering with community health systems, and looking for ways to help older adults and their families understand the value and the benefit of living in senior housing, but knowing that that is a journey and a process, and that some of that might have to start sooner than a crisis. And so I think we will, continue to see some innovations there and new partnerships with home health agencies and other community partners that are helping with managing some of those staffing changes and needs that our residents are having in our communities as well.
Yep.
All right, Gaurie, thank you so much. At this point, we're going to turn it over, and we've invited Dustin Teskey, our partner here at Direct Supply. He is the marketing manager for our TELS division, and he's going to talk a little bit about resources from Direct Supply that we've been working on. And I'm going to turn it over to him. So Dustin, welcome.
Thank you, Liz. Thanks, Gaurie. And again, thank you all for joining us and viewing this webinar session. I have to say, as noted, we're all doing things slightly different, and Direct Supply is unique in some ways. We've been a part of this industry for 35 years, and we've always enjoyed the experience. But I do want to note, just like today's discussion has shared, we're looking at things a lot different, and we've seen our relationships grow even though travel and things have shut down. We're having much more aggregated discussions with multiple providers or organizations, or really more pointed, more involved and engaged discussions as to how we can help. And we appreciate the opportunity you provided to be a part of that conversation. I want to start with TELS, but talk through a couple different options of ways that you can take advantage of some of the free resources or already available assets that you can put into place today. So similar to our theme, I want to start a little bit on the policy side. And as we slipped into the COVID crisis and began to respond, building management and Direct Supply TELS is really one of the first places we saw our customers turn. Two different things that we've been able to support and stand up. As Gaurie noted, as Liz noted, we've seen a lot of innovation within our service space into categories we previously wouldn't have gotten into. Things like cleaning and disinfecting services to augment or support with terminal cleaning, or to help prep up as we shut down and clean the common spaces. And even now, we're seeing lots of new innovation and solutions develop within the indoor air quality space. So talk to your partners at TELS and see what's available for that. Specifically speaking, as we all look at the concerns related to airborne transmission and droplets and aerosolized particles, we've got a group that we're proud to introduce and really bring to market and support that's able to show a 99.45% reduction within 30 minutes in SARS-2 COVID within a clean lab study. So reach out to your sales partner or whoever your direct relationship at Direct Supply is and find out more about that or any of the other services available from building management and Direct Supply TELS. But one of the things that you may not be aware of is the great policy work that's being put into TELS platform. The most obvious way that this comes to fruition is when you think about TELS platform. This is really building management's or senior living's #1 building management tool. It is a platform for you, built for you off your feedback. And these checklists is one of the greatest ways to help drive regulatory compliance on aggregated best practice or industry regulations across your organization or across your community. So if you're a regional or corporate, you have access to this through your IR or interactive reporting dashboard. If you are an administrator or maintenance director, you have access to this through administration. But TELS checklists are great tools to take a template, for example, standing up a separation unit or potentially reopening with this post-COVID. Again, we're not necessarily moving out of it, but moving out of the post-COVID of the early part of the onset of the year. And what these checklists allow you to do is customize across the sections. For example, our reopening checklist has 4 different sections to it. Policy related to what's required to open, internal policies related to your emergency plan and reviewing that, and then opening up for guests, and then opening up for new admissions and opening up your centers and services inside as well. But this is a great way for you to enable action, push down information, and then really start to develop and communicate and educate against the new plan and implement for your innovative services and your innovative offering to really reopen up for your residents inside or for new residents coming in. If you're interested in more information, please reach out to TELS. You can find our 800 number at the bottom here. Or if you're already one of the 13,000 members that use TELS today, again, reach out to your TELS sales rep or partner to find out where you can access this and implement the checklist for the reopening or separations should you still have COVID positive residents within your building. Another great way when you shift from policy to rethink design. So Gaurie has really talked a lot today about how we first look to policy, revisit our views on the world in the midst of COVID, and then how we use design to create space for that. I love the picture that was shown of the 4 residents sitting around a table where you push the tables together. Creating innovation interventions like that is a great way to create space and safety and trust as you reopen, whether internal or for guests. Or you can reach out to Aptura as a design build firm. They offer solutions across the spectrum. And one that you may not be aware of is the refresh solutions that are available. So 3 stages of work here: consultation, selection, and order. They can take a simple space such as an entranceway and help you redesign and revisit the flow as we look at the screening policies and innovations such as thermal cameras, tempomic thermometers, or simply creating interventions so that high touch areas don't receive the same level of touch and you have a reduction in transmission rate. So feel free to reach out to Aptura, www.aptura.net, or talk to your sales partner or closest friend at Direct Supply. We'd be happy to get you in touch with someone at Aptura to talk about some of the trends that Gaurie and her team were discussing earlier, or just get you involved in some of the consultation or services available through that group as well. Lastly, I wanted to touch on a couple things that Direct Supply as a whole has been doing. Just like you jumped, we've jumped as well. And you're going to find a lot of direct results on directsupply.net or a Direct Supply network. We've actually stood up, and you can see on the screen here what our homepage looks like. There's 3 areas of great information to take advantage of. Our product section is really focused on 2 things: helping you understand in the midst of all the supply chain issues, what is available, how quickly it can be available, and really driving focus on what products or solutions or alternative interventions are available in the midst of the COVID crisis. So if you're looking for alternative disinfectants that are EPA approved, head to our products page. It's going to tell you not only the ones that the EPA has said is appropriate for SARS-CoV-2, but it also is going to give you the information as to the availability of it. Secondly, there's great industry resources we've linked right off here as well. I'm sure you and your organization are part of other great member organizations such as ACA or NCAL or a variety of the other leading edge groups that are out there. This is a great aggregated spot to find level up information from the CDC, from OSHA, and others. As we've learned more, we've shared and stored that out there. And lastly, there's a lot of great ideas and expertise. And as we shift over to the Direct Supply Insights blog, either off of Direct Supply Network or Direct Supply Insights, directsupply.com, you're going to find a ton of great content. Really, our team has been incredibly busy taking your feedback, aggregating that, merging it with what we're hearing from industry experts around memory care, around building design, around indoor air quality and HVAC, and really trying to get out as much content as possible to help you better understand how to respond in the midst of COVID and to find ways to create conversations and relationships to really assist. Again, Direct Supply has shifted, and we've really focused in on what solutions we can bring for you. And those solutions are based around your asks and your best aggregated best practice. And these insights off of our blog is a great way to access that. So I would encourage you, keep an eye open. Many of the webinars like this one do end up on here within the week post-loading. Last but not least, I just wanted to say thank you for the opportunity to join you today and to be a part of this experience. As we discussed, Direct Supply has had this great opportunity to be involved in senior care for 35 years. We know that you have the opportunity to serve all those great people out there that are seniors, and we're honored and really appreciate the opportunity to serve you, the great people serving those great people. We couldn't ask for anything more, so thank you for your time today, and I'll turn it back over to Megan.
Just one quick note. We want to say thank you to everyone who took the time to view the important information. This wraps up everything we have for you today. Our big thanks to Gaurie, Liz, and Dustin for their time. And you can look for all of our upcoming webinar invitations to be sent out via email or located at directsupply.com/webinars. Thank you so much.